So that's just basically a summary of what I've already indicated, the aspects that we review. And again, the summary of the 2-day situational assessment for folks with TBI, the 2-day with folks for the non-TBI.
I may have missed this because I stepped out, but
Sure.
Does it have to be consecutive days? Because we have situations where there's clients that they can't do 2 days. They simply can't do it. Back to back.
That's what we want.
That's kind of the point.
We want to demonstrate. Yeah.
Okay.
So they're all they're always cumulative because we always want to be able to demonstrate. The first day they lasted 6 hours and they left half an hour shy of what we were supposed to. They came back in the second day and basically they were in tears the whole morning. They basically couldn't function.
Okay, so that's the spin on it.
That's right, exactly. So
Because
basically it's part of...
Sure, it's always, there was no maximal effort, they quit, they failed to finish the assessment.
Right, right. And so we're basically oftentimes reinterpreting that and saying, yeah, with people with bona fide pain disorders, that's how they perform. There's nothing suboptimal, secondary gain about that. That is the inherent nature of their, psychiatric disorder, their pain disorder. So we say, yeah, look at all the times that the IE quotes the person having taken breaks, having broken down. And it's actually relatively rare, surprisingly, for the post-104 to say that the person is a malingerer or to say that they're not genuine. Usually they'll just say, yeah, they have some problems here, but they can still do these occupations. So, and they give us this whole paper trail that's beautiful that we can turn back on them and say, you've proven your case to yourself. Not only do we have our evidence, but your OT, your psychovoc, your maybe FAE does document very similar things. So now we have 2 test periods, one that was obviously very biased and interpret things in a clearly biased way, and then ours, which shows a certain picture, and in fact, theirs shows the same thing. Okay. The other thing we always include is a significant other interview with these now. We do that for all of our neuropsychs, all of our psychovoc tort cases, and as well as for our situational assessment. Again, it just speaks to the continuity, and if there are any issues around secondary gain, lack of genuineness, just having that other piece where things are corroborated just, again, helps to pull everything together and offer a different interpretation relative to malingering, exaggeration, or the like. Okay. We don't call it torture anymore. It's occupational therapy. So, yeah, they're going to struggle to come in consecutive days. It is going to feel like torture to them. But on the other hand, that is the kind of data that we really need to be able to pull everything together and to demonstrate that there's a real post-104 disability here.